I'm here at the Georgetown Public Hospital Corporation, where the Parliamentary Sectoral Committee on Social Services is presently conducting a tour in the wards of the hospital to have discussions with staff and patients as to the treatments and services being offered here. This visit at the Gphc is a continuation of a series of visits at medical facilities across the country embarked upon by the Parliamentary Sectoral Committee on Social Services to observe and make recommendations to the relevant authorities on treatments and services offered at the various locations.
Ultimately, our intention is to ensure that healthcare is delivered effectively, and so that anyone coming to any of the hospitals across the country can access healthcare as it's meant to be accessed. In fact, we are aware that there is a drug shortage and crisis in the country, very much so, and this has impacted on people of all walks of life.
That was Chairperson of the Parliamentary Sectoral Committee on Social Services, Dr. Vindhya Prasad, addressing reporters. Director of the GPHC's Accident and Emergency Unit, Dr. Zulfikar Bucks, pointed out that one of the major challenges that still persists at the hospital is that of overcrowding, since on a daily basis, the GPHC is filled with a number of patients from all over the country.
The unfortunate thing is that this department serves the entire city and also serves the entire country in terms of referral. Patients, we do have quite a lot of referrals coming from different areas for various reasons. And it does at some point impact in terms of the amount of patients we can take care of, because as I said before, we have to take care of the entire city, and the most important challenge for us is the overcrowding. Because as it stands at most point in the week, we have more patients than we actually have beds in terms of taking care of.
Although the hospital staffers are constrained in this aspect, there is a system presently in place to alleviate some of this burden, says Dr. Bucks.
We have a system in place in terms of the overcrowding plan that works very well, but it's still affecting in terms of efficiency of care, and sometimes effectiveness when you have more patients that are coming in the report, because we cannot reject referrals, we have to take referrals. So there are times when there are 4 or 5 hospitals calling sending patients. We don't have beds, we still have to find ways and innovating to take care of those patients.
Meanwhile, Dr. Prasad noted that from the findings of the visit at the GPHC, the Parliamentary Sectoral Committee on Social Services will be in a better position to make the necessary recommendations to the National Assembly for the betterment of the staff and the nation with regards to quality of healthcare at the GPHC.
In addition to the recommendations emanating from our visits and our recommendations based on what we would have observed, or in our engagement with various members of staff and those who utilize the services of the hospital, we can engage with management, we can engage with ministry officials, and we can even engage with the ministers and ministers of health, so that they can give us answers as to why things are not functioning as they should.
Reporting for HGP Nightly News, I am Kristen Macklingam.